Resilient Idaho was a collaboration with Idaho Public Television, Optum Idaho, the Robert Wood Johnson Foundation's leadership program. It is an amazing, it was an amazing collaboration and an amazing piece of work that was done. Started well before the pandemic, but then as it progressed, it was right in the middle of everything. Made it much more difficult for the filmmaker to do interviews and so on. It was really quite a labor of love and care and so on, with the idea that, although even for those people who know about ACEs and have heard about ACEs and know about resilience and know about the positive childhood experiences and the healthy opportunities for healthy outcomes from positive experiences kinds of study that we had with Dr. Sege last September, we may know those things, but sometimes people, I think, perceive them as being something far off, something that's happening in, that some of the films that we've seen are based in Boston or in San Francisco or San Diego or someplace else, but not Idaho. And this film really was developed to give a perspective, again, from Sandpoint all the way back around to, I think maybe the furthest north we were was on the east was Idaho Falls, but covers most of the whole state, and really was intentionally done that way so that people could see themselves in it. And so that's what we hope we put across. Hopefully you're seeing this film as hopeful representation, and a testament really to the kind of amazing resiliency that people have. So without further ado, so we don't get further behind, Austin, if you will start the film, I appreciate it. Thank you. And everybody, please keep yourselves muted, because apparently it throws off the sound for everybody if we're talking in the background. So I'm going to do the same. I really have to give kudos to Idaho Public Television, particularly for really embracing the passion I think all of us had for developing the film. And really, putting their all into it. It was an amazing process. I'm going to ask Jean to talk about it a little bit once we get into a little panel here. I just want to mention that in addition to a couple of people that are going to be on the panel in a second, several of the people who are in the film will be doing workshops. Luis Granados will be also Zeke, who you saw mentioned, Shannon McGuire, Keith Orchard, Ty Simpson, and Jean will also be doing workshops. So you'll have an opportunity to experience them in a longer format, than in the documentary. So let me introduce, again, Melissa Merrick is going to join us to be a panelist for this conversation. We have probably about about half an hour to talk about the film and to talk about various aspects of the film and ways it might be used and so on. Jean Mucci, who is community health manager at St. Luke's and was in the Robert Wood Johnson leadership program that really was the inspiration for starting this event. And I will try to now get my little phrase right that Jean says all the time, investing in a generation for a generation, which is, I think, such a great phrase for what we really need to be doing, and I think reinforces some of what Melissa had suggested earlier about that we tend to think in short term, and a lot of this work is really generational work. It's work we have to do for a generation and probably for generations, but we will change things if we think in longer term. And then the third person who will be specifically references Holly Whitworth. And Holly works for Eastern Idaho Public Health and has been involved in home visiting, particularly with parents as teachers for a long time. And I consider her certainly one of the home visiting gurus. And I look to her often for just advice and thinking on what we need to be doing in terms of prevention, and one of the more articulate people in that arena. So Holly, if we can find Holly, is she somewhere in there? Can we grab her up too? There she is. All right, hey Holly. We learned this new technique apparently with Zoom now. Instead of just having to do a webinar, they can spotlight people, and now you are in the spotlight. So cool. Well, thank you for being part of this. And I guess I'm just going to start with Melissa, since she was not in the film, and I'll just ask her a question, since you've been involved for so long in developing, really, I think, the ACEs, our ACEs understanding around the country, and the solutions and the understanding around resilience and so on. But, it seems to me it's taken a long time for that whole thing to seep into the the more mainstream conversation. I'm wondering what thoughts you have around that, if it surprised you, either how long it's taken, or, how much the uptake has been, now that I do feel like, like I think we heard judges and teachers and, folks talking about it who, although we've been talking about it for a number of years, I don't think they would have been talking about it 3 years ago. So so anyway, go from there.
Yeah, thank you, Roger. And I'm happy to be among Holly and Jean for this discussion. I have to say that, the moment is now, right? I think that those of us and, the late 90s, that's when the original ACEs study took place. We know there have been hundreds of other studies that have, confirmed ACEs are common, ACEs affect health and well-being. So I think we're now in the business of, okay, and now what? Like, how can we use this ACEs science to really, propel the movement toward prevention? And again, when I say prevention, I mean the whole prevention continuum. So very complementary from many of the things that were shown in the film, but it showed, I shared before that I'm a child psychologist, and, when you do any kind of parent training and such, you tell parents, like, it could take 11 presentations of a new food, for example, for a kid to develop the taste buds, or to say, oh, I don't eat white food. And then finally, like 11 presentations, if it's going to work or not. The same is true in messaging. I know for some of us, as soon as you hear about the ACEs study, it's so compelling. It's so true to the children that we know in our communities, at our schools. And it so encompasses the experiences that we see, that we just get it, and we have like that aha moment. But for others, it's still a little bit far away, for lots of reasons, right? Whether it's their own disbelief or denial or whatever. But the more, so we still always have work to do to raise awareness. But I think there's so many of us in this movement that are just like, okay, now let's use this science and for prevention, for hope. What I loved about that movie is, the hope, the resilience, the balance between adversity and possibility. Also this understanding of the intergenerational components. And like I said, the intergenerational good stuff and bad stuff, right? So how do we do more of that good stuff? I think the moment is rich and it's wonderful. And it's a moment that we need everybody's different perspectives and voices at this conversation.
Jean, would you like to talk maybe some about the making of the film, and some of the plans, I guess, going forward, or we can save one, I don't know, talk about the film being made and some of the process, and then let's maybe talk about how it's available to other folks to use it, and what we're planning in terms of getting it out there.
Sure. Thanks, Roger, and glad to be amongst these amazing folks today. And thank you for all of you joining in and spending time with us. As Roger said, I was part of the Robert Wood Johnson Foundation Cultural Health Leaders Program, which is a 3-year intensive program that really looks at addressing really health inequities, health disparities across our country. And you are kind of in a think tank group with 30 leaders from all across the country, including Puerto Rico, Hawaii. It's really incredible opportunity. And we are challenged in our 2nd year to start thinking about a strategic initiative. In childhood trauma, the intersection of childhood trauma, and then how, we've heard both Melissa and Roger say, our childhood lasts a lifetime. We see it show up in our emergency department all the time. Historically, we've, kind of termed those folks as frequent flyers. But just like we're talking about in our judicial system, we have to become more trauma informed and start to really fundamentally ask, what has happened to people? I promise you that we will not unburden our healthcare systems with costs and impact if we don't start addressing what's happened to people early on. And Holly and others who are doing this, in utero with women and families, you don't get a guidebook on how to be a good parent. And I have a teacher friend who reminds me all the time, people are doing the best they know how. And I think if we start with that and stop blaming and shaming and start really better understanding, everybody has a story, as we heard in the film, some not as healthy as others. But it doesn't mean that we can't continue to build resilience in people across the lifespan. But fundamentally, I think in Idaho, I have the role of working at St. Luke's, but I'm also on Nampa City Council. As leaders, what do we resolve that we will commit to investing in our communities? And we know in Idaho, this is hard. We are more of a pull yourself up by the bootstraps. And I love to have that conversation with somebody and tell me a 4-year-old who has a boot to put on. We have to start really thinking about the value that we place in our kids now, we will reap for their generation and the next generation to come. And if we continue to say we won't invest in early childhood ed, we're not going to talk about those things because they're hard. Probably a lot of you today saw yourself mirrored in some of the conversations in the film. And I would be remiss to not say we have incredibly brave Idahoans who shared so authentically about really hard things that happened to them, but then the hope. And really, when you fundamentally break it down, it was an adult who believed in them. It was somebody who did not give up on them. And we've heard the kids at Breaking Chains repeat that. You hear them talk about Luis. He's walked in our shoes. He talks the way we do. He looks the way we do. Kids can't be what they can't see. And if we continue to tell them, you're committed to failing because this is just your lot in life, they will continue to fail. And so will we as communities and generations. And Roger will tell me I'm always preaching, but I will preach, because there is no child that at 8 years old we should give up on. There's no child across their entire childhood that we should ever give up on. And if we say that 3rd grade is so predictive, what we invest in those early years is so fundamental and foundational to the health and well-being of these children, and then the generation they will become, raising the next healthy kids. So the project to me was not only important from a community health perspective, but it's very personal to me. I think we all have our ACEs stories, but if we won't start to talk about what it looks like in Idaho, and we just bring films in from out of state, people can clearly say, that's not us. That only happens in San Francisco. No, folks, this happens here, and it actually happens at a really high rate. Typically here in Idaho, more than the broader US. So this gives us, I think, a tool that any of you can use to start having a conversation. And I think where we can find sort of commonality is, what is our shared value in our children? And if we find shared value in our children, when we invest in them, their potential and possibility is limitless. So Roger, I hope that answered your question. Thanks.
That was Jean comes from a family of preachers, so you hear it, sisters and brothers. You got it. Holly, so you really work on the ground. I mean, you're doing the work, daily, or have done it daily. Sometimes I think you're managing and supervising, doing all of it. But do you want to talk some about what you see? And and I know we had I was really impressed with some of what you were saying about, even as you moved into doing telehealth conferences, what the impact is. And I don't know if you can just jump off from what I just said, but I know Holly has been, like I say, I feel like Holly's been a mentor for me over, the 13 or so years that I've done this work, and really, help me understand, kind of how it all really lays out. I'm a system kind of guy, so the on the ground stuff is, gives me real connection.
Roger, maybe we can first get an amen for Jean.
I'm sorry.
I said maybe we can first get a big amen for Jean.
There you go. Amen.
Amen.
Right on.
Testify.
Preach.
Yeah.
All right.
Thank you, Roger, for the opportunity to be on the panel. And I'm really grateful that I can be on with Melissa and Jean, and just benefited so much from your powerful words that you shared so far with us. So home visiting is literally the boots on the ground. And sometimes it is messy work, being with families, and it's challenging work because it's all based on relationships. It's those relationships that happen in the first 5 years of life that are so valuable. And those are the things that we want to lift up in home visiting. When we enroll a family in a home visiting program, we're really looking to identify what strengths that family has, and then to meet that family exactly where they're at. Not having any preconceived agenda items or anything like that. We want to help that family realize their own capacity to deal with things. And Roger and I have had many discussions about what COVID-19 has looked like for families and what's happened to families. Not only families that are enrolled in our home visiting program, but families that we've seen across our state and across the nation and even across the world. But we've seen that COVID-19 has increased all of those factors in a family's life that are challenging. The parenting factor, the employment factor, the relationship factor, the housing factor. And for families in Eastern Idaho and in Idaho, some of the things that we've seen happening are families losing employment, families where housing was tenuous at best is now makes them very vulnerable. We've also seen families that have been doing both schooling of their parents and trying to work. And then there's that technological gap that happens for families in our home visiting programs. And when Melissa was describing what could be done with some of those community-based child abuse prevention funds, just getting the technology to families, especially in rural families in Idaho. We know that there's a big gap there for them to be able to access those telehealth opportunities and that technology that they need. But one of the things that's really been important for us as home visitors is realizing that we need to be slow with parents. So their capacity's been diminished during COVID, but we have to realize where they're at. And honestly, by being slow with parents and being very intentional and being there to listen and reflect with parents, we get more traction and we get further than if we come in with our ideas and the way that we're going to fix a family, because we are not fixers. We're there to meet families where they're at. We're there to acknowledge the hard work that they're doing. And we're there to help them that understand that they all have resiliency. Resiliency is built into each of us. It comes up in different ways, but they have it. And we really want to help families realize that resiliency that they have. Realizing that parenting is not a skill that you learn and all of a sudden, aha, I have it, I'm a parent, but it's an emotional process that home visiting can help families go through. And there's an urgency with home families. Sometimes there's an urgency because relationships are very evocative and things come up for families. And there's also a potential for danger for families and loss and a lot of uncertainty, especially during the last year. So as home visiting, how do you meet a family where they're at and help them navigate that potential for that uncertainty and that danger and that loss? And we do a lot of infant mental health work with families during home visiting. We do a lot of helping them understand that sometimes it's hard for our families to be in two worlds. They find themselves in two worlds because we have families that are involved in systems, and it might be that child protection system that Melissa was talking about, or that judicial system. And what happens is we have families that are in these systems and trying to navigate both of those, that relationship world and then that system that families find themselves in sometimes, because they have trauma that they've experienced as a child related to those systems. The parent may not understand the system. They may see the system as something that's going to hurt them or take something away from them. And that's really challenging for parents. So just trying to understand exactly what parents' needs are, helping that parent to build that dyadic relationship between the home visitor and the child and the parent. We find that is some of the most important work that we do in home visiting. And then it's exciting. The documentary was exciting to see all the faces of hope that were all over Idaho, because we know that collectively we can tell the story of hope. and we can tell the story of each individual child in Idaho and each individual family. And then we tell the story of each individual organization, the Trust Fund, the Gene's Resiliency Project, Luisa's work. We all come together and we build a better place for these families. But for us in home visiting, it is literally boots on the ground, and it's messy sometimes. And it's also so vital that we do this important work. And so I appreciate the opportunity to speak to that.
What I love too from that film, I think it was something that Jean said, but this concept is prevalent, you know, that for so many of our families in Idaho and around the country, the zip codes can be more predictive of their health and well-being than even their genetic codes. And, you know, it's provocative to say it in those ways, but it also points squarely to the fact that we can do something about it, because it's environmental. It's not something wrong with that person. And like, you just said, resiliency is within all of us, but it's also in all of our communities. And it can be in our context, our larger socio-political or whatever societal context. So to me, there's great power in understanding that relationships make the world go round. And so building that trust, building that rapport with home visitors, with other community members, with other safe, stable, nurturing people who can provide that relationship. But those relationships exist within a context and a zip code and an environment, a physical space that can also help to honor and lift up and empower these relationships, and other contexts that really stifle that trust and, really harken back to histories of trauma and historical trauma and other things. So I think, at every moment in that film, there's this play between the great program and relationship building stuff that is critical, but also this larger backdrop of things that we can all do to help bring out all of those protective factors and contexts, and really to build that resiliency in communities and in families.
Holly, one of the things that I remember from one of our early conversations around COVID was you were saying for those, some of the families, or you were saying how some of the families who had protective factors going into the pandemic weathered the storm. And I don't know, why don't you enhance that a little bit?
Yeah, I remember that conversation with you, Roger, because what we were seeing when COVID started and our program went to remote home visiting, my staff, I have an incredible staff, and really anything that we accomplish to assist families or support families is due to that staff. And they're all over the state, and whether it's home visiting, whether it's early care and learning, social work, we have a committed community of people who care about the welfare of children. And that in itself gives us hope. But the staff that we have at Eastern Idaho Public Health, when we went to virtual, it was a huge learning curve for families. And as it became apparent very quickly that those families that already had those protective factors that were embedded in some way to some degree, whether that concrete support was a faith-based community or a family or a school or a home visiting program, and whether that, whether the social connections, the friend that they had, the sister, the extended family, whatever it was, those protective factors, if they had them, they seemed to be able to ride the wave. And first the wave was shock, and then kind of disbelief, like, I can't believe this is happening. And then the wave was, okay, we're going to figure this out, how we're going to do it. And then kind of to ride the next wave of kind of getting that hope that, okay, there's an end, something, we're going to make it through this. And so as parents and families started to ride this wave, what we saw was if they had the protective factors, it was almost like they could hang on to that life preserver and they could get through the wave. But the families that didn't have those protective factors in place, those families that were already vulnerable, where they didn't understand child development, the social and emotional competence in relationships wasn't there for them, and housing was already vulnerable, or the loss of a job happened, or all of a sudden education was curtailed in some way for members of the family. Those were the families that we saw that suffered and that fell through the cracks. So there's something to be said for having those protective factors in place for families. So when things like a pandemic come up, or things like a bump in the road that happens in relationships in families or in their communities, they're able to ride that wave and get through it. Because those families that didn't have it, it became apparent very quickly that things were much more challenging for them, and the circumstances were so much more intense for them. The depression, the mental illness that we saw coming up, child abuse and neglect that we saw were all increased with those families that didn't have that capacity.
Jean, it looks like you're ready to jump in, or I can ask you a question.
I was just going to add to what Holly's saying, that I don't think it may take a generation before we truly understand and appreciate the fallout from COVID. So I think that what we saw in the crisis, when people were willing to lean in and wrap supports around, we're going to have to make sure that we have healthy and resilient communities that continue to lean in rather than look away. Because I think we are going to see, we're talking about food cliffs, we're talking about, massive housing disparities. And when we already know we have high mobility in many of our communities for our kids, and that safe, stable, nurturing environment oftentimes is school. I think Keith Orchard said it so wonderfully in the film, we put so much at the feet of our schools. And when we expect them to feed kids, clothe them, make sure they have a safe, stable home to go back to, and then make sure you teach them and that they're meeting benchmarks, we have to really fundamentally shift the conversation around how we're going to look at post-COVID. And I know we're not there yet, but it's been a remarkably hard year inside our healthcare walls. It's been a slog that I think we're now people are starting to kind of feel the emotions of it, because it's been autopilot. And I think, just amongst my coworkers, you're just starting to see some of the PTSD set in. And I think our communities are going to go through that. We had this shared traumatic experience that I hope really did create some empathy, but it can't just create empathy. We have to act. And I think we have to really have a sense of urgency around what that action looks like. So coming to conferences and learning is so important, but then it's the doing after, and how we link arms and we connect these supports so that we don't ask people who are in crisis to go to 17 different places to get the supports they need. We really have to start saying, what is the scaffolding that we are willing to build to deal with what we know is a crisis coming at us? And I think we're going to see it for, at least a decade. I don't really know. Melissa's probably more expert on that than any of us, but I just think it's going to be a crescendo of crisis coming at us, and the scaffolding we build right now will really start to predict, I think, what's going to happen to people.
Yeah, I couldn't agree with you more, Jean. I think, we are going to be seeing this for a really, really long time. And I would say, along with the scaffolding, this is also an opportunity to do things differently. All of our home visiting models pivoted to virtual and phone-based, but there's something really beautiful in that flexibility too, right? That we're able to, we had a story where a mom was going to go back to in-person college with a new baby, and we're able to still, her family support worker is able to still be with her in a virtual visit, where in a traditional home-based model only, we wouldn't have been able to help her through that transition. So there are opportunities here that are also becoming apparent, along with the many, many challenges. I mean, that is for sure. But so I think it's, again, about figuring out what is working and doing more of that, and what is just not working, and why are we still doing those things, right? And there could be a whole host of those things that we're talking about. And I would just say the movie also makes me think about the power, though, too, of evaluation. I mean, I can't come here as a scientist and not say that we want to know what are the, I don't know if I'm lost. I'm
You're
frozen.
sounding fine. You are.
Okay. Well, I'm lost in a weird position there on your screen, but what are the important nuggets from the different programs, that are so impactful? I love, and I just wrote down, kids can't be what they can't see, right? There's pieces of this that we're learning all the time, but let's evaluate it. Let's be a model for other communities, for other states, for other, jurisdictions where they can take up these kinds of programming too. I'm really struck to learn about all the great things that are happening in Idaho, because it's like, I've never been to Idaho. I was looking forward to joining you in person in Boise this year, but it's like, what are we learning too? And then how do we do more of that? And then again, provide the advocacy and funding so that we can support more of that.
Well, we will reprise that opportunity so you can come to Boise, but thanks. So there are some questions in the chat, so I'm going to try to see if I can get through some of those. Judge Hodges, I don't know, just says, how do we access home visitors? And I don't know, Judge, if you want to say anything more about that, I mean, beyond your hallelujahs and so on.
I didn't, I really don't have. I have heard through the school districts, we've used our school nurses informally, but that's just not a program in our district that I'm acquainted with, or the logistics of getting one going. And I think it's phenomenal. If we can get the home visitor out there before a CP case, it makes such great sense.
So South Central Health District does have a program, has Parents as Teachers program. Holly, did you want to say something more? Why don't you say something more?
Oh, I was just going to say, I love that Judge Hodges has joined us and that he's bringing that up, because you're one of the most powerful advocates that we have as home visitors. And I've met with judges before, and once they realize what those prevention programs and intervention programs can do for families, it's a great thing. And I think Roger can go on to speak, but we have a state McVie team, and there is a home visiting program in every district in our state, either a nurse family partnership program or a Parents as Teachers program. And so you can get connected with those resources, and I'll go ahead and let Roger follow up with what he was going to share.
No, mainly that on that question, but Pat Kennings has thrown in the link, Judge, so you can take a look at that. It's based in Twin Falls. I don't know how much stuff is happening in Cassia County, but maybe, I don't know. Holly, do you know that? I actually don't know that. But
I do not know that, but I think if he goes to that link, and I know Kelsey has also put up a link. She's our McVie state lead there, and that's another place that you can go.
Yeah, and I agree with you. I mean, I think that's where, if we can get more of these preventive services, into as they relate to, again, your situation with dealing with juvenile corrections, juvenile justice work, it's just so critical, and there's so many different things we can do. I thought what Judge, the Magic Valley judge who spoke, gosh,
Ingram.
Yeah, Judge Ingram said was so powerful, in terms of like thinking about how, hey, if we knowing that it's really about kids' adverse childhood experiences, how we deal with them to recognize what's happened to them versus what's wrong with them. Or Luis's story, of Judge Bale, saying, hey, I see something in you, I'm going to give you a shot. And he took it, and it just makes such a difference in the world, when we do that. Jean has been really responsible. Sorry, go ahead.
See, that's great news. Jean, even though it's Lent, can we do an hallelujah now? I'll leave you alone.
We can hallelujah all day long. I'm good with that.
Jean has done a lot of work in her community and in Canyon County generally around, really gathering some of the people like the prosecutor, the sheriff, some others, judges, who, aren't necessarily our usual suspects. I don't know if you want to talk a little bit about that, because I think the impact of that has really helped to shape up the 2C Kids Succeed effort. And, I think really some ways we can start thinking about what we can be doing in other communities.
Yeah, thanks, Roger. So I think it's always easy to go to the people where the conversations just flow because we all have that kind of shared idea of what needs to happen. But trying to pull some of the cross-sector stakeholders to the table who are imperative to move the work forward has been really important. From, as you saw, law enforcement to EMS, education, faith-based partners, of course, our social services, healthcare, just across the board to really start to have these conversations. And what I've found more so than anything is that adverse childhood experiences are showing up in their work, irrespective of sector, but in different ways and with a different level of understanding. And I have really not found anybody who hasn't, once they learn more about ACEs and then, conversely resilience, I think there's an aha moment where everybody can kind of say, oh, if that wasn't me, that makes sense when I think about maybe a kiddo I grew up with or, a friend of my child. I'm seeing a lot of different things. And I think it's also easy to connect the dots on when we see these disparities really crescendo across our community. We can find pockets where it's easy to say, oh, that's an underperforming school. Well, is it? Or are they dealing with a ton of childhood trauma that doesn't allow them to get to the same level of academic rigor that maybe a school across town is? So I think really flipping the conversation, changing the narrative around our shared humanity and value for our kids, we've really been able to start the work in Canyon County with great support from our mayors, some county commissioners, and then again, really the activators, the people who are doing the work on the ground. And we've found really willing partners who, when COVID hit, everybody could have leaned out and said, oh, there's just too much going on. But I found that they leaned in with all their might. And then we've been asked to talk to other areas across the state, and working with Optum Idaho, what we'd really love to see in 2021, because we know it is going to be so imperative, is that we have a regional collaborative that follows the geography of each of our public health districts, so that all of Idaho has their own local collaborative launched along those boundaries, and then you're doing your own local work to lift your own community narrative. But really, the education and awareness has been a primary focus. And you saw Roger in the film presenting to the Senate Health and Welfare Committee. And after that, what you didn't see is they challenged us. Well, what are you going to do about this? How does everybody not know about this? And so what do you do with an idea? Well, we make a film. And so what we really wanted to do with that film was make sure that everybody could see it and nobody could deny that, oh, that stuff doesn't happen in Idaho. It does, but more importantly, so does hope. There's so much hope. And that's what we have to elevate. And so how we link arms intentionally across our state, I invite all of you to join the Idaho Resilience Project. Roger and I and others on here are part of that organization. And really that is to build that statewide system of connected supports for families and others. Also to link you up to people who are doing like work. So lean in wherever this makes sense. Judge Hodges has been great. He's helping in Magic Valley with the Region 5 collaborative. There's a lot of great people doing great work. And what I would caution you is don't ever think that somebody isn't the right fit for this, because there's some really interesting folks who will show up to this conversation differently than I've seen them show up to any other conversation we've had. Chambers of commerce, bankers. So I think some of those where you might say, that's kind of an unusual partner, pull them to the table, and they have brought such immense value to this conversation. Thanks, Roger.
Thanks, Jean. A few other things. We would be remiss not to say that Early Head Start and Head Start also provide home visiting programs. And so they are in various places around the state. I think maybe we're saying Project Launch does. I was not sure that maybe that's the case, that they're providing also home visiting services. There were a few comments. Oh, we got Melissa back. Yay, Melissa, good job. Janet, I think this is Janet Goodliff, says, I agree many of the issues, even with stable families, have not been seen yet. This has been rough for all families. In our church communities, we are hearing words like, we have, quote, lost a third of our youth to COVID in different ways than just having the disease. So, some concern, I think, over kids' mental health and their, and their attention and all of those things. Shannon Fox says, I'm providing a support group to children at an alternative high school, and it's amazing how they know what they need what they need to overcome challenges, but it just often is not available within their communities. And, that is a resource issue, which, maybe some of the, this new money that's coming down, we're certainly starting conversations with folks about how do we use this money. I'm hoping the legislature just lets us do it, but so we can talk to people with lived experience on the ground and people doing their, doing community work, and to understand more about what it is that we need in our communities, because there is a lot. I have my current phrase has been, we have some of everything and not enough of anything. And so I think we have models that are good and models that are strong, but not enough, to really have the kind of impact that we want to have. So that's, so that's my current mantra, and hopefully some of this new money will help us to do at least some more of what we would like to do.
I think too, Roger, the one thing that Shannon said, I think children, adolescents, families, they know what they need if we would only listen sometimes. So sometimes it's not a resource issue necessarily, or a services issue. It's that we don't really take time. As Holly was saying, we think like we might know best and we want to go fast and give them the great, referrals and services, and we're not listening to really what the true challenges are and what they're struggling with in the moment, which is why having home visitation and other kinds of supports already available, right? And so people can access, and family resource networks and such are so powerful, because they really allow you to really get to, right, what are the true needs? Like, what are the immediate needs, and then the longer term needs, helping you problem solve and figure out how to best access that. I was struck, and of course I've never been to Idaho, but struck by, all of the footage of like the very rural communities, and, how it's even more difficult, right? Just when you look at access and transportation and other things. So the availability is one thing, but I also think that we as a field need to be better listeners. And in this time, I think we're going to have to open our ears and our hearts and our minds for many, many years to come.
Judge Hodges, I think I saw your hand up or finger.
I love what you just said, Melissa. It's someone used the phrase active listening earlier, and it is such a meaningful practice skill that we all need to be aware of it. And that's what you just said, and I appreciate that very much. Thank you.
Well, folks, this was a fantastic conversation. The keynote was amazing. The discussions on the chat and all of that, you guys have been, it's been a great morning. We have two more. Tomorrow, we start with Dr. Sarah Matamora, who's also a child psychologist, a research psychologist from Denver University. So does amazing work around toxic stress, around some of the issues that also taking some of those big theoretical ideas and putting them on the ground, and they're testing out a lot of new ideas. And so hopefully we'll get a piece of that. She's both doing a keynote and a workshop. And then we have 6 workshops that are going to happen in the afternoon, or it's not the afternoon, just later in the morning. So we'll have those experiences, and we're also going to have an experience of talking some about a new project, which Kristen Bonet sort of brought to us. It's called Ribbons of Hope, which is something that we're going to add to our the work we're doing around Child Abuse Awareness Month, Child Abuse Prevention Awareness Month. And so it's anyway, and hopefully a good way for you to think about some things you can do in your community. I'm sure we could talk more, but we're trying to save everybody's, this whole being on Zoom too long can be harmful, I think. So,
Roger, may I add one thing before we go?
Of course.
Sorry. I would be remiss to not say, addressing childhood trauma and building resilience cannot be the movement of the moment. This has to be the generational work that we all commit and submit to doing, or what we will see again. I am just really worried that we're going to continue to see increasing crisis. And sometimes these things seem cool because books are out and people are talking about it, and then it becomes fatty and we move on. And we can't move on from this. This work will literally save and transform lives and communities. And so I encourage you again all to partner in whatever ways possible. Start the conversations in your community, share the film, share resources, but also really build hope in hopeless places right now. We all need much, much more of that. So please don't let this just be a movement in a moment. Thanks.
Can we get another hallelujah? Hallelujah. All right.
Love it.
Thank you all. And remember to do your evaluations. They are on the Padlet. You know, as Melissa Merrick said, as a scientist, you can't say no evaluation. We got to say evaluate, evaluate, evaluate. So those are on the Padlet. It's something called, what's it called? I think maybe it just says evaluation. I don't know. What does it say? Evaluation survey. And then you can reach the different levels of that. But please do that. It really helps us to understand how we're doing, and and because we can get this day by day, it also gives us a sense of what we can do to change in the next 2 days if there's something that you'd like to see different. So again, appreciate you all. Thank you for being part of this, and look forward to seeing you tomorrow morning. Same time, same station.
Thank you. Adios.
Adios.